Before we jump in, I'd like to just review a handful of housekeeping notes before we dive into our webinar. Okay, so now we can get started officially. So as I said earlier, I'm Sandy Watts. I'm the Industry Manager for Health at Esri Canada. And thank you so much for joining our webinar, which is all about geospatial technology as a relatively new approach for closing gaps in health equity. I'm really thrilled and proud to have our collaborators from Reach Nexus join us today. That's Kristen McLennan and Andrew Weber. And the three of us are going to demonstrate how geography and really GIS technology can better help us understand where health inequities exist and how we can act to close those gaps, especially for our priority populations, right? So, brief agenda. I'll start with a broader introduction on the geographic approach to addressing health inequity, with a handful of examples of GIS applications from health teams really across the country. I'll then pass it over to Reach Nexus to describe some of their strategic initiatives, and then they'll also go through some live demos of the GIS applications they've built to support these initiatives over the years and going forward. And then, as I said, we'll finish it off with some time for Q&A. Okay, so taking a bit of a step back here, I'm sure this is sort of familiar territory for those of you out in the audience today, but really, right now in Canada in 2025, health equity is like really one of the most urgent public health challenges and really healthcare challenges that we face. To me, health equity is just entirely central to public health practice and service delivery. But across the broader spectrum, right, if we think about the primary care crisis, over 6 million Canadians still lack regular access to a family doctor or to a family care team. And this, in a lot of cases, is related to inequities to that access. We know that a lot of rural and remote communities still remain underserved, right? This also relates to access gaps, inequities there. We also are seeing increasing climate-related events from wildfires, extreme heat, even air quality, right? And this amplifies health risks in many cases for those that are already most vulnerable. We're also seeing that rise in housing and homelessness, right? This is corresponding to rising public health challenges across the country, and really not just in urban centers, right? This is a big rural problem as well. But if we look across these issues, these inequities are not just social or economic, they're also spatial, right? Where you live, affects your access to care, your exposures to different kinds of risks, even your life expectancy. And so, in that regard, health inequities aren't random, right? They repeat in patterns across certain populations, neighborhoods, even across regions. So, understanding where these inequities exist is so essential to addressing them. Okay, so this brings us to our first poll question. I just wanted to ask to see if this list that I've pulled together here, which do you think is the most shaped by geography or by location? I know this is not an extensive list, but I thought representative of the kinds of problems we're working on right now. So maybe it's access to primary or emergency care, maybe food insecurity or food deserts, access to mental health or harm reduction services. Maybe it's exposure to environmental risks or climate-related risks. And finally, I've added in here housing instability or homelessness. So I'll just give you a few more seconds. I can see the results sort of piling in here. Again, I know there's many more challenges many of us are working on, but I thought this is a nice diversity of examples. So I'll give you a few more seconds. Let's see the results here. Okay, so maybe we can end the poll, have the webinar team share it for everyone. So yeah, this is great. This is really interesting. It looks like, first of all, lots of us think that geography is linked to all of these challenges, and that's kind of the point, right? That location is so inherent when we talk about access to care. Really interesting that, the biggest result here, access to primary care, relates to location, and I think that's absolutely true, especially for those in rural or remote environments. But I think what's important here is that there's so much data we can bring together for all of these challenges that can be mapped out, right? And so that's where GIS comes in. Okay, I'm just going to close this. There we go. And so for many of us, we know that a GIS is really a system that helps us create and manage analyze and then map all different kinds of data. And so in this regard, GIS gives us maybe a clearer picture of health inequity because we can bring together all of that different data that we need, right? Whether it's social, environmental, maybe our health data that we're collecting from our programs. This can be so easily managed and then visualized in GIS. So that's great. Next, we know that GIS can help support that monitoring and improvement, program improvement that we need to do, whether it's tracking our program progress, locating additional access gaps, or maybe adjusting and adapting our programs to those new insights, right? In fact, you'll hear a lot more about this when Reach Nexus showcases their initiatives. And finally, increasingly, we're finding that GIS and these maps are important to help communicate these insights more clearly. It's a really intuitive way, to help communicate inequities to different kinds of stakeholders that have varied backgrounds. And this helps guide more equitable decisions, right? It's more evidence-based decision support. In fact, this is the specific reason we're seeing more and more health teams rely on GIS to explore social determinants of health, right? This is really prevalent across the board, public health, primary care, you name it, right? We're really interested in understanding and unpacking, income and behavior and culture. And so GIS is a great way to bring all the data required to represent and symbolize social determinants of health, to be able to understand these critical questions, right? Where are services missing? Who's most affected? Where do these priority populations need help? And maybe which neighborhoods are facing these common disadvantages or these common issues. So next, I'm just going to go through a handful of examples of GIS applications by teams across Canada who are sort of showcasing and unpacking health inequity in their program. So this first example is here in Ontario, and this is the Peel Health Data Zone Information Tool built by the Peel region. This is a really impressive ArcGIS built tool. It helps locate and prioritize neighborhoods that might be more or less advantaged. What you're seeing right here are all the data related to walkability, the Walkability Composite Index. This is honestly one of so many different modules within this Health Data Zone tool that you can explore and understand where some neighborhoods might require specific kinds of supports. This example might be familiar to many of you. This is out in Nova Scotia. Our collaborator, Dr. AJ, who's actually a family doctor, has been building this tool called GeoView over the years. And within GeoView, she's actually built a social determinants of health dashboard. So within this app, like in her clinic, she can click on a patient's dissemination area, just based on what the information that's in her private EMR. And so she can quickly, at her fingertips, review the community context of her patients, whether it's employment or income, indigenous identity, household information. So this helps and enhance her to be able to provide that, social prescribing or even to connect them with subsequent care closer to where her patients actually live. If I go to the other side of the coast over in BC, this is a really interesting tool called CHIA, so the Community Homelessness Integrated Application built by the City of Abbotsford. And this is really amazing because the homelessness outreach teams that are on the ground in the communities can use ArcGIS on their phones actually to help locate and report maybe new encampments, risks, maybe required resources in those encampments. And that information is just compiled in real time back to the city, back to the community services teams, so they can react and respond and support those communities in near real time, which is amazing. Last example here is just from Laval University in Quebec, who have published this vulnerability map to understand exposure risks to extreme heat. So this helps pinpoint and locate those neighborhoods most vulnerable to help prioritize and strategize resources accordingly. In fact, this application is available across the entire country, even though I'm zoomed into Montreal right now. That brings us to the reach portion of the webinar. This is just one of many examples of the ways that GIS is helping improve their work on HIV and syphilis and STBBI outreach across the country. Really thrilled to have Reach join us today. That's Kristen McLennan and Anderson Weber, led, of course, by the director of Reach, Dr. Sean Rourke. Really excited because, on Monday actually is World AIDS Day, December 1st. And quick note on that, we've seen almost a 70% decline in global deaths related to HIV/AIDS really since 2004. And this is largely due to greater access to diagnostics, treatment, and to prevention. I really think of Reach Nexus as a pillar and key leader in actually supporting this effort in Canada. So kudos to Reach on that work. But also, second, it's been almost, I think, 4 years, almost to the day of our initial setup of our strategic collaboration between Esri Canada and Reach Nexus. So thrilled to have them join us today to showcase the kinds of things we've been working on and the applications of GIS that they're building for the future. So with that, I will pass it over to Anderson and to Kristen to take it away.
Right, thanks,
Sandy, we'll just
Sandy.
wait
Oh,
for the slides
Yeah, no
to
problem.
appear.
That's
Okay,
great.
so
Yep.
that was a really great introduction, Sandy, and appreciate you putting up the teaser of our I'm Ready program. We'll get into that in um, a little bit later. Um, but so yeah, Anderson and I work at Reach, and this is the front page of our current website, where you can find out more about the programs we're about to talk to you about. But just an overview. So Reach Nexus is a research group. We have ties across the country, and we're working on how to address HIV, hepatitis C, and other STBBIs in Canada. And our focus is really is really about reaching the undiagnosed, implementing and scaling new testing options, strengthening connections to care, improving access and options for prevention, as well as ending HIV stigma. So our programming, we have a variety of programs. We're going to talk about three of them today. Um, but what our programming is it's really centered around ways where we can reach the undiagnosed. So um, in ways that people across Canada are comfortable with and provide them with treatment or care for those who test positive or provide prevention options for those who test negative. And really, this all started a couple years ago through our first clinical trial where we brought the HIV self-test to market. So we did the Canadian clinical trial, we provided the data to Health Canada, and that sort of started us off. And then the three programs I'm going to talk to you about today are I'm Ready, our Health Box, and our Ayaangwaamiziwin initiative. So before I get started, we're going to launch a second poll question. And just because I know the audience has various backgrounds, what percentage of people in Canada have undiagnosed HIV? And what that means is have HIV, but don't know that they do. So as you can see, the options we have are 0.5%, 3%, 11, and 20. So we'll just let those responses come in. Okay, so I think we can go ahead and move on. It seems like we have a little bit of a cross section of responses. So we can go back to the slides. And for those who said 11%, you're correct. So it's a fairly large number. I think the poll results have 32% of people in the audience guessing the right number or knowing the right number, I should say. Um, and what that means is there's over 7,000 people in Canada who aren't benefiting from the life-saving treatments that we have to offer. So what our programs are really getting out there and providing these options to people to know their status. So for some context, so this slide is an image that is in the PHAC surveillance reports that come out every year. You'll notice that this is from 2023, 2 to 3 years old when these are released, which really highlights the need for the real-time data aspect, which GIS allows our programs to provide. We have high rates of HIV in the prairies. A lot of our work is focused there, and we'll get into some of that in a few minutes. So I touched on this, but we value what we measure. We need the data to be in real time in order to act appropriately to get the resources to the people who need them when they need them, um, and not two to 3 years late. It's helpful, but it's not. It could be better. Let's put it that way. So actually, one thing that was really exciting that happened to our group a couple years ago. So this was at the International AIDS Conference in 2022 in Montreal. The government announced a large financial investment for HIV testing. And so what they did was provide funding to provide HIV self-tests, and they asked Reach Nexus to be very involved in the procurement and distribution of these self-tests, along with our partner agencies CAN, CBRC, uh, yeah, and ourselves and Katie as well, sorry. And so what we were able to do in 2.5 years was reach 10,000 or 100,000 people, distribute 250,000 kits through the various programs that I mentioned. And this wasn't an effort that we did on our own. We had over 400 agencies who were partnering with us to do this distribution and also collect data in real time. So what you'll see here is of the 100,000 people who participated in this program, we have individual data on just over 19,000 people, probably closer to 20,000 soon. And we know where these people are. We know if they're a first-time tester, when they tested last, and a few key details about them. So in that time where we ran this program, we were able to show the government that you can collect data in real time and it can be beneficial in order to scale and implement programming. Unfortunately, after we finished distributing the tests and spending the money that was allocated for this program, PHAC wasn't able to refund it, even though we were able to show success with all of our monitoring and evaluation efforts.
Okay, this is me. So, hello everyone. I'm going to be talking about kind of the outline of what we're going to be talking about and kind of how we are getting into GIS here, and we'll go through some demos as well. So first, we'll introduce three of our programs, which Kristen started. We'll also talk about kind of the goals behind each one. We'll then outline kind of the key program needs we aim to address with the GIS. And then we'll show kind of how we're meeting those goals and those needs with live demos. So hopefully those go smoothly. And yeah, we talk about three programs. I'm Ready, which is about HIV testing and access to HIV testing. Our health box, which is like a smart vending machine, which is pretty cool. And then the Ayanma was Ayan. I'm just not gonna say that live because I now. Yeah. So let's talk about why we use GIS. So why do we use GIS at Reach? So the first reason we use GIS is to it really makes data intuitive for the people we're sharing with. So if we're sharing with community members or health leaders, it's a way to show the data very effectively and it's kind of like a universal language. We don't GS is a small piece of what we do, but it's really become really important to all of our programs. And it's the first inclusion in all of our grants and presentations. We always have a picture of the map and we sometimes do a demo. They can also reveal trends and patterns that you can't see from tables. Um, and geography matters in terms of health equity. Most you know inequity has some geographic component that can really help highlight those inequities in areas, and kind of we can link program data to social context as well to kind of help with that. And we can also monitor programs over time, which is really useful, and because community needs change over time, and so it's important to keep that in mind. back to Kristen.
Okay, so I alluded to this a little bit when I first started, but the first medical device that our team was responsible for getting approved was the HIV self-test. This is a blood-based product made in Canada out of Biolytical Laboratories in BC. So we did the trial, we showed that Canadians can do it themselves, and we submitted the data to Health Canada to get it approved. From there, we had a very quick 6 to 8 months where we integrated the approval of that self-test into our I'm Ready program, which launched in June of 2021. And we actually were able to do this alongside of Teresa Tam on a webinar announcing the launch of this program. So that was very exciting. And so, why is self-testing important? We knew at Reach that HIV self-testing was a highly effective approach to reaching the undiagnosed and helping people to know their status. Negative, positive, didn't matter, but we wanted to also reduce stigma from traditional testing methods. We know some people do not want to access healthcare in the traditional methods, and we need a lot of different options to reach those 11% of Canadians who have HIV and don't know it. And so self-testing has shown uh, to increase the frequency of people's testing. We know it's confidential and private. You can do it wherever you feel comfortable. And from there, through our app at least, we provide resources and information on where people can go to access prevention or treatment. So in more details, I'll just talk about I'm Ready. So you can see here there's a photo of a phone. What it is really a mobile app. It's available on Android and iPhone to really let people take control of their health and to know the status when and where they're ready. And so this program includes the app, like I just said. It also includes a built-in telehealth navigation portal where if people have questions about testing, they can make an appointment with one of our peer navigators. We're available, I believe it's still 10 to 10, Monday to Friday, and our peer navigators are very knowledgeable in the test itself, in where to go, and how to help you navigate the system. We also provide all of this information on our readytoknow.ca website. This program started as a research study, and after around 2 years, we converted into an implementation science program, reduced some of the questions and the barriers, and we're still trying to improve it in a second version, which Anderson will talk about in a little bit. But so far, we have nearly 15,000 people who have downloaded the app and finished a quick pretest survey and then ordered a test for either pickup or delivery to their house. So this is just a snapshot from our website with the 4 simple steps. So you get the app, you order the test, you conduct the test, you can share your test results anonymously in the app. I should mention that the entire app is anonymous. Um, and from there, you're connected to the resources based on your test result and where your profile is to help you get connected to care for next steps or prevention, such as PrEP. So I keep mentioning this pretest survey, which is basically the bread and butter to the connection with GIS. So we do this survey in Survey 123, which is an Esri platform, and connect it to our app. And from there, we're able to learn about our participants in an anonymous fashion, but also know where they are and some key characteristics about them. So I'll let Anderson talk more about how it's connected into the platform.
Okay, great. So I'll be now getting us started on kind of the GIS demos and kind of what our goals were. But before we get into that, just a small housekeeping note. The data and the apps we're going to show are at, various stages of development, and some of the data is, demo for demo purposes. And also all of our participants are aggregated to the forward sortation area, so we don't collect their exact address for privacy reasons. So you'll see points on a map, maybe at the very north you could possibly be, and whether they're there or not, that's just the centroid of the FSA, not where they actually live. So for the I'm Ready program, we kind of had three main goals for integrating GIS into this program. Our first goal was participant oriented, and it was to help connect people to services in our app. So we did this through an instant app called Near Me. So to help connect people to where they can get an HIV kit, essentially. Our second goal was to monitor the program and visualize kit distribution across Canada. So, having like a main picture of the program that we keep live is really helpful. And also being able to kind of filter and deep dive into kind of different provinces or regions is helpful, especially when we're meeting with stakeholders or community leaders. And we did this through ArcGIS dashboards. And finally, the third goal was simply to tell the story of I'm Ready. It's been going on for 4 years now, and over 4 years now, and we've got a lot to show and a lot to kind of show everyone. So that's what we're doing with story maps, and so we're really excited about that. Um, so I'm just gonna some small context before I get to the first point. Kristen touched on the I'm Ready app, which allows anyone in Canada to anonymously get an HIV test through either getting it delivered or picking up at a location for free, which is kind of amazing. But we recently did a experience survey, trying to improve the app. We're always trying to get feedback, improve the app, make it easier to use, and have less barriers for access. And one of the kind of feedback we got was, you pick up a location, you pick a pickup location in the app over here, but you just have a drop down. And so, without a map, it's difficult to really know what's the best place to pick up or what your options are or where you should go. So this is obviously a GS problem. People need spatial context for this sort of stuff. So that's kind of our first thing that we're going to show. And so I'll start the demo. So hopefully everything goes smooth. So this is something we actually just started working on recently. And let me just so it's essentially using the Find Nearest Instant app, which is very easy to use. So you don't have to be super GIS savvy to use it. And how it works is this is designed for mobile. I unfortunately can't show it on mobile because my phone isn't connected to the share. But so essentially you go into the app. It'll be embedded in our I'm Ready app eventually. And it'll ask you, if you want to use your location or just enter the app. Using your location is probably more beneficial, but since we're doing a demo, I won't do that. So this will show you kind of all the pickup locations and all the community partners we have across Canada. So you can see we got pretty good coverage, and for where we don't have good coverage, we offer deliveries. And so these blue kind of dots are the pickup locations, and we also have our help boxes, which we'll talk about a bit later. So I'm going to just, for the demo purposes, say we're at St. Michael's Hospital. Oh. 30 Bond Street. There we go. This is the fun of doing a demo. So you can choose, how far you're, interested in looking. The default's 10 kilometers. And, when you put it in, so let's say this is where you currently are. So you'd use your current location on your phone, for example, and you'd kind of be brought in with these options. You can see, it'll be sorted based on, how close or far they are from you. So we have our Dixon Hall Health Box very close to St. Michael's Hospital. But let's say you can also go through the map. Let's say, I'm going to be around Allen Gardens. I want to choose this pickup location. Well, you can go and, look at it, get some more information. So this is a pharmacy.ca site. You can get the postal code, the address, the hours of operation, when you can pick up a kit, and the number that you can kind of contact them at. And the best way to you can actually put directions within this app through licensing some credits, which we didn't have. So we don't have the directions exactly in the app yet, but a workaround is you can use Arcade to kind of embed a different mapping tool. But I guess to be clear, this is sort of a workaround and isn't quite as useful, but you can see you got your location and it'll bring you there. But the better way to do it would be to have the directions embedded right in here. So that's how we're kind of working to help connect people with services a little uh, with less barriers to access. Um, and yeah, so that's the first demo. The second demo we're going to show is kind of our main dashboard. So Sandy kind of alluded to this a little bit in the first image. This is sort of our updating dashboard that we have is sort of like a home base. This is just for internal use mostly, or if we have a presentation or we're meeting with some health leaders from Canada, we'll often show this. So on the left we have our participants, how many kits we've distributed in the program, and then how many people submitted the results. So we now have 62 positives, but only 25% of people have actually submitted the results. So it's potentially, 4 times higher than this. Or, not everyone's comfortable with, submitting the result in the app, and that's totally okay. And then in the legend, we have, where our first-time testers are, where our participants are, and where kind of the background kind of polygons, which are how many participants we're meeting. And then we have all these key pops here and people kind of who are aware of PrEP or have used PrEP before. It's all kind of interesting information that we need to keep track of. But let's say we are meeting with some health leaders from the prairies. So this is a really powerful kind of way that we can show them kind of how we're making a difference there. So we can choose, a combination of provinces, for example. So let's add these three. So now we're looking just at the prairies. We can show them, this is how many people are reaching the prairies. This is how many kits we've delivered to date. Our positivity rate actually goes up. So, the positivity rate in the prairie is higher, which we know from the kind of the infographic that Kristen showed earlier. We can also just look at youth. You can change dates. And the one other thing we have and that we're working on is kind of some equity components. This is part of some larger analysis we're doing. So we can look at where people are actually coming from and use that with census data to kind of see what kind of areas we're reaching. So, for example, like in Canada, where the quartile 4, the highest areas in Canada where most people are living alone, we're reaching a lot of people there. And when there's income inequity, so a lot of people living below the low income measure, we're reaching 60% of our people at that low measure, where only 30% of Canada lives there. So we're reaching twice as many people in low income areas of Canada than would be expected from the census. So that's kind of how we keep track of equity, and we always try to do that, and we do a lot of work offline on that stuff as well. But so yeah, that's our kind of main kind of home base. And then one more thing for I'm Ready that I'll show quickly is story maps. So this is something we've been working on, and it's not a final version at all, but I wanted to show kind of the story map we're working on. And this is really powerful because, you don't even need to have a website to really show kind of what you're working on and how you're doing this is, right in Esri, we can share this, we can put this on our website, we can do a lot of things with it. And it's kind of just telling the story of HIV in Canada, the challenge, which is, HIV actually, there were more new cases in 2023 than there were in 2022. So it's actually, not all, there's a lot of work to be done, and that's kind of why we're here doing it. And you can have these punchy headlines, adding transmission starts with a test. This is kind of our solution. So we got links in here. We can embed a video. This is kind of another thing you can do is we've got these big headers, this is how many people we're reaching, this is how many kits we've distributed in I'm Ready, and these will update live in your actual website, which is really cool. So you don't have to worry about updating these or having a picture. These are, live connected. We're also looking at where we're reaching everyone in Canada. So this is, a useful map to see, we're really reaching everywhere in Canada. And so that's really great. Um, we tell a story here, how we got here. So Canada's first self-test was approved in 2020, and Reach was played a big part in that. When our program launched, our first data summary, and then our conclusion to the research program, but our continuation to support Canada. And then you could do a little more like in-depth stuff here with kind of a map story here. So these are all our pickup locations. We've kind of looked at where people are choosing to pick up or get deliveries. So, here there are provincial differences. We've left with the territories for this analysis, but because the N was very small, but you can see, there are differences in where people are picking up or getting kits delivered. And I mean, a lot of that has to do with how many locations we offer, but and also looking at kind of the urbanity or urban versus rural, and looking at in rural areas more people are getting deliveries, which is expected, and a lot of those people probably wouldn't have got tested if deliveries weren't an option. So it's great. And then we're also looking at first time testers. We're always, this is one of the main key populations we're trying to reach, and we've done some work looking at them, and it turns out that participants that live in rural areas that we know now from having this map are 1.5 times more likely to have never tested before. So these people in these rural communities, which maybe, stigma, there aren't a lot of people in their communities, there might be heightened stigma, or they just don't have access to these testing initiatives. So we are getting the kits out to them. So one more thing on equity. So this is sort of part of more analysis that we're doing. So we're looking at where, again, we're reaching people in Canada. Um, Essentially, these are odds ratios, and we're comparing where we're reaching people to the reference group, which would be the Canadian population, so the expected um, kind of group. And essentially, all to be said is, we're reaching 2 to 6 times people in the I'm Ready program are 2 to 6 times more likely to be in these more highly vulnerable areas. Um, and especially, we found that people in the I'm Ready program were 6 times more likely to be in areas with high income instability and in those kinds of neighborhoods. So we're really reaching the neighborhoods that really need it. And then we have a little bit of information on the results submitted. We have, our positives are going up year over year, and then a little bit of live charts from Esri that look at kind of our positives themselves. And so 58% of our positives are youth under 30, which is really striking. And then you can have a link to go to the app, of course, and some news stories at the end. And yeah, that is our story map. So we'll quickly, for time, let's go back to the presentation. Let me go back to sharing.
Okay, so the second program we're going to talk about is our health box, which Anderson sort of showed you quickly where the locations are on the I'm Ready map. And the reasoning behind that is because our health box contains self-test kits. And so if people want to pick it up at a health box, they're absolutely available. And so the health box is basically a large vending machine. This weighs 1,000 pounds. It's a big ordeal. It's temperature regulated. And they contain HIV self-tests, like I said, but also harm reduction supplies or other things that people or communities are choosing to put in the box that would be helpful for their constituents around the box. And so here are just a few pictures of it. So on the right, we have how it looks like inside, your typical vending machine, obviously not candy bars. Some people have granola bars. The self-test kits are at the top there. On the left, it's a good image of somebody at the front of the health box. It's basically a large iPhone screen on the front. And then there's a database or software piece that links all of our health boxes together. So how this started, this is a slide from Sean, who Sandy mentioned is our PI. She was at Ensemble in New Brunswick where this program launched. And basically she called up Sean and said she has some money, she wanted to buy a vending machine. How can we work together? So that was a really exciting start to this project to know you already had somebody engaged and some funds to support it. And so here's just an example of what some agencies are putting inside the machine. So you can see in the naloxone kit, there's some water bottles, soap, condoms, harm reduction supplies. Some agencies put seeds in the vending machine, and a variety of things, hats, sunscreen, mittens, socks, depending on what they need. So here you can see the interactive experience. So the person at the front will walk up to the health box and they'll sign up. They'll be able to answer a couple quick anonymous questions again, um, get the products that they're looking for, and then we also have this map view on the health box itself, which sort of links people to services in and around the area. And so, like I mentioned, it's anonymous data collection. All we ask is that the person create a profile, which is a number, a color, and an avatar. It's in English and in French, and available to people who indicate that they are 16 years or older, or 18 in Quebec.
Okay, so I'm gonna go quickly through these slides now as, oh, let me turn my camera back on. Uh, so I think it's coming on. So essentially this slide is just to say we have a lot of data. So we have data on over 170,000 visits to these health boxes. We have now over 80,000 items dispensed and 45,000 surveys completed. So we have a ton of data and it's really powerful, but and we need to share this data with the sites and the communities on the ground, but we can't just give them a spreadsheet with 170,000 records. So that's sort of why we need GIS. And also we're scaling. So this is a map of where we have 22 health boxes now, and we're in talks with 90 plus communities to get more health boxes. So we are scaling fast for sure. So I'll quickly talk about how we use GIS for health box. We need a solution as the program scales to have data shares to every individual health box. So our first goal was to provide hosting sites, key data and do a really deep dive into data-centric dashboards with things that they want to know. So it's usage, users, and items dispensed. So a much more detailed one. But also we needed to deliver scalable dashboards because we needed a dashboard per site. And we started with 10, but when we did this, but we have 22 now, it'll be 100 eventually, potentially. So this is why we used URL parameters, which I'll get into, which essentially, lets us have one dashboard that we need to maintain, but infinite views of that dashboard for each site. And a unique link for each as well. So, which is really powerful. And then I'll also talk about how we made sure it was password protected and secured so that these agencies could access it, but it wasn't public. Back to the demos. So I'll show you our kind of community health box. This is our overall view, which has all of our health boxes. And so you can see all their locations in Canada. The Northwest Territories ones just very recently launched. And the blue dots are kind of the draw for where people are coming from, noting that a lot of people either choose not to put an FSA in, or maybe they're unhoused or they don't have an FSA. So we only have 22% completion for the FSA question. And yeah, now we'll show, so we have multiple tabs here. So we've got a lot of data that I'll show, and we kind of worked closely with the sites to kind of get what they wanted. So I'll show you, this is the first health box that was launched. It's the Ensemble Moncton. So you can see the end here, which I'll talk about maybe a bit later. We have the same health box link, but then the name equals Ensemble Moncton. So that's how we get this Moncton view, which is really great. So this is kind of zoomed into their kind of stuff. We have kind of machine usage, demographics here. I'll go quick. We of course start with the instruction page. So this is kind of we originally had like a massive table, but that's not very friendly to just someone coming to look at some data. It was kind of a massive ugly table, so we kind of worked through it a better way. So this is a way that we can really look at the demographic data in kind of an easy and interactive way. So we have, we can see how many people are underhoused. These are all binary kind of underhoused, I guess, or not underhoused. And we can filter through the different key populations. So if you change it to youth, it'll change, the title to total number of youth, and you can see who are underhoused, who completed high school. So you can compare like, okay, youth are had less visits to healthcare than the total participants, and you can literally look at any demographic here to kind of deep dive, which is really powerful. We have substance use as well, so sort of the same thing. You can view that as well. We also have supplies access. So this is one of the more useful pages, I'm sure, for the sites. They can see who's accessing their supplies, what their kind of how many they've dispensed. So Moncton dispensed 7,000. This is how many harm reduction, self-test kits, sexual health supplies. You can also see individual items here. So these are the specific items. You can download a summary of the data as well, and you can choose, go different months as well. This health box was down for October, and so you can see the supplies there, and then you can also see supplies that were accessed by key pops. So, yeah, you can see youth, etc. See, we're running out of time. I'll go to visit metrics last. This is how you can see where people are visiting, when they're visiting, what hours they're visiting at. So this is like a kind of a chart. You can see what hours people are generally visiting on different days. And the last thing I'll say is, yeah, so this is kind of Sackville, so you can just change the end of the URL to Sackville, which is right next to it, but it'll change all the numbers to Sackville then. And so you have all the different health boxes with one dashboard. And so I'll stop sharing that. And I know we are low on time, so I will go back to the presentation. And we can quickly go through. This is just URL parameters. I won't go through that though. I'll skip that.
Okay, so this is the last project that we're going to talk about and our newest. So we don't have nearly as much information in our to share, I guess. But basically, because of what I started out saying, how there's a lot more HIV and rates and going in the prairies, how they're increasing quite drastically. We created this program, which is called the Ayaangwaamiziwin Initiative, to provide a preference testing design to people in the prairies. And so anyone who comes forward for self-testing, or so sorry, for point of care testing for HIV or syphilis, they can enter into this study. Part of the study uses an investigational testing authorization for a device that is under investigation. So looping back to our clinical trial piece. But people ultimately get to pick if they want to test for HIV alone, HIV and syphilis together, or syphilis alone. And so this is a partnership that we have in place with Indigenous Services Canada, PHAC, CAN, and ourselves, as well as our community partners. So I'll just skip over this, maybe, Anderson, for the interest of time. And so what this project offers is a two-eyed seeing approach, bringing in Indigenous and Western approaches together. Like I said, it was built in partnership between Indigenous leaders, harm reduction organizations, and our frontline communities. And really what it's centered around is cultural safety, getting people to test where and when they feel comfortable, involving peers or community health representatives. Like I said, it has an embedded clinical trial, and we're just starting to build out the GIS pieces of this project. So here's just a slide on the rates, which I sort of already highlighted with my initial image. And then our five key areas is really to involve people with lived and living experience, sorry, to expand low barrier testing, culturally safe interventions, create a real-time data system for rapid response. If we see an outbreak, we want to be able to send a community team there. And then really use knowledge mobilization pieces and the maps that we can create to drive policy change. So for this instance, we use REDCap, and Anderson's going to talk a little bit about how we connect the data from a very well-known database into GIS.
Okay, I'm gonna speed through this, but essentially we use GIS to track real-time kind of testing and positives. We also, one of the challenges Kristen mentioned was it was in REDCap and not in Esri, so we use Python to pull the API and make the data spatial, push it into the dashboard, and then you can set it to regularly update. So we have like live data. Anyways, I will quickly go and just give you a very brief overview. This is still work in progress, but essentially this is our kind of view, and we can look at, where our syphilis kind of, I guess, positives are and, where they're clustering, where we're seeing results. We can also see, what tests are used, how many reactive tests have 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 come up, all the syphilis treatment and HIV treatment we're tracking, and also we're working on kind of getting some kind of temporal analysis done because it's really about tracking, you know, disease and keeping live updates for this. And we're going to be working with the sites to create dashboards for them individually. And yeah, I think I'll leave it at that as we're short on time and pass it back to Sandy.
Great. Yeah, thank you so much, Anderson and Kristen. It's always so impressive, all of the work that you're doing, generally speaking, and then seeing all of the work that you're doing on the GIS component, right, to pull it all together. So really impressive work. So I just before we get into the Q&A, wanted a very quick question. I know we've had lots of information about GIS and health equity and REACH's programs. Just wanted to put this out there. If you wanted to stay connected and learn a bit more about this work, you can click yes. If not right now, that's obviously a-okay. We just wanted to get your feedback here to make sure that we are connected going forward. Again, Reach is one of so many different projects that we're connected with or that we've been hearing about across the country of teams using GIS to support their programs, just like Reach has been doing as well. Okay, so I'll just maybe I'll keep the poll open for a second, but I'm just gonna go to our questions. So we've got a few questions here. Actually, one was kind of more of a practical one, which is kind of funny. It was just, will you have access to the recording of the webinar so that you can share to colleagues? Yes, absolutely. You'll get a post-webinar email that'll include the survey and the recording link. So yeah, feel free to forward it to your colleagues. Just a heads up, they might have to just add their name and email to access that, but they'll have access no matter what, that's for sure. Another interesting question here, and this was just, let me see if I can find it in the Q&A. So I navigate the Zoom thing here. Yeah, just an interesting question, Anderson. So the Healthbox dashboards, sorry. He just noticed that how they're sort of embedded within other dashboards and different tabs. Just curious about how, you've organized those dashboards or if you have plans going forward to consolidate them in different ways within your GIS framework or GIS design.
Yeah, so the goal was first of all to give just like one dashboard to the site. So we have a internal like experience builder, I guess we call it the ArcGIS kind of dashboard hub. And so we have kind of a tab which has all of our dashboards in one spot, which is really helpful for us. But for the sites, we just wanted them to kind of be separate. So they have all their tabs, but each individual health box is its own um, kind of URL because we want just to give one URL to the sites. Not that we don't want them to see other people's sites, but like they are really only interested in their own. And another way to do it would have been to embed each one into Experience Builder, which we didn't end up doing, but that might have been a more nice solution. But that's sort of where we landed.
Yeah, yeah, totally understand that. I know it's always sort of a work in progress too. You're sort of building this out slowly but surely. So maybe only over time do you start to see how to optimize that. Um, Okay, got another question here. This is interesting. Based on what you've maybe gleaned from even the GIS component, the mapping component, do you see any opportunities or has it informed where you can strengthen like HIV and maybe STBBI prevention and care over the next few years? Like, so going forward, has it helped inform, where you can adapt the program?
I mean, yeah, and even development of the new programs, right? So with I'm Ready, it was a national approach. We were really just seeing who was interested and who was going to take it on, or order test kits from our program. And that along with other data was it was really showing where people are interested in getting tested. And so we did move a lot of our efforts towards the prairies in our recent work. Um, and kind of decide, if is there a health box we need to prioritize right now over another health box because of just, manpower. So it definitely does help us guide where we want to go. And then I will say within Ayaangwaamiziwin itself, because we are able to
Mhm.
see like the trend that Anderson was showing, new diagnoses here or there, um, some of our community agencies go out into community. And so if we're seeing a hotspot, they could take their van and go, north instead of south next weekend or something like that
Mhm.
and offer more testing to people who need it.
Yeah, yeah, absolutely. That's sort of a big part of the puzzle, isn't it? One quick question. I think we have maybe a minute here. There's a question. Someone saying here they have a health box in their community, but interested in how they can get training as an NIC about the operation.
I don't know what an NIC is. Maybe that doesn't matter, but um, to get training about it, you can visit any of the health box locations. So if you have one in your community, and there are staff on site who can talk you through it. They've obviously been trained on how to keep it operated and stocked and all that stuff. And a lot of our community agencies are really happy about the health box and they have shared it with other community partners. And so for in Winnipeg, for example, we started with one. A second community agency saw it and they were interested as well. And this is now two launched, but potentially three or four more coming.
Right. It's amazing. Yeah, it's amazing to see the breadth and the expansion of Healthbox over the years. I remember when there was one.
Yeah.
And now it's across the country. It's amazing. Okay, that's all the time we have for the Q&A. Just one more thank you again to Kristen and Anderson for sharing the Reach story and all of the work you've been doing using GIS. Before we go, quick note here are some resources. The Reach Nexus homepage, some of Esri Canada's strategic health initiatives, just like we're doing with Reach Nexus. And if you're interested in self-guided GIS tutorials, I've added a link here of the Health GIS curriculum. But yes, once again, thank you so much. That link will be available to you. We encourage once again to use the survey link and provide your feedback. And if you'd like to contact us, I've added our emails here. If you have any questions about GIS, health equity, and the REACH program. So once again, thank you all so much for joining us today, and we hope to hear from you soon. And I guess happy Thanksgiving for those of you who celebrate joining from the US. Thanks, everyone.
Thanks, Andy.
Thank you.